Hey everyone, Luke here with the Knee Replacement Therapist. In this episode of the Need to Know Show, we're going to talk about some quick fixes that you can do to help alleviate pain when you have a flare-up of knee pain and stiffness and symptoms either before or after knee replacement surgery. Before I jump into that, be sure to hit that subscribe button and turn on the notifications so you can catch all of our latest videos related to knee replacement surgery. So these are just some simple techniques that don't require any equipment, just using your own body, your own physiological processes to help hopefully kind of calm down some pain, discomfort, stiffness when you get kind of that flare-up of symptoms either before surgery with arthritis or other issues with the knee, or after having knee replacement surgery. They work well too. And the target or the focus of these exercises is to promote blood flow, promote oxygen, promote nutrients to the knee joint itself. And the best way that we can do that is through movement and through muscle contraction, which puts some compression and relaxation forces through the joint. So those movements and that compression and relaxation forces through the joint are going to help promote that nutrition, that oxygen, that blood flow to the joint, and hopefully have a pain relieving effect. So first of all, what you want to do is have somewhere that you can lay down, and one way that you can do this is through muscle contraction. And one of my favorite ways to do this is isometric contractions. So that means contractions where you're squeezing the muscles tight and you're holding a position. So the joint itself is not moving, the knee's not bending or straightening, it's just holding in one position. So one way you can do that is a quadricep set. So you can do either sitting up with your legs out straight like this, or laying down, or if you're in a chair, having your leg up on a chair. And all you want to do is try to push your knee down into the surface. You'll feel those quadricep muscles of your thigh tighten up, and just hold it for maybe 5 to 10 seconds and then relax. Push, hold it for 5 to 10 seconds and then relax. Hold it 5 to 10 seconds and then relax. And usually you can do maybe about 10 repetitions of that, give or take, enough that you start to notice that the joint starts to calm down a little bit. Usually the first few repetitions are going to be a little bit more painful and uncomfortable, and then as you do a couple repetitions, it gets a little bit easier. Then what I like to do right after that is some isometric contractions of the hamstring muscles, so the muscles in the back part of your thigh. And I like to do this in a kind of a progressive way by progressively bending the knee or flexing the knee further each time. So what I'll do is I'll start in this position with the legs out straight, and this time, instead of pushing your knee down, you're going to push your heel down into the surface. So you're going to push your heel down, hold for about 5 to 10 seconds, and then relax. And then I'll kind of bring my heel up a little bit, bending the knee, and then I'm going to do that same thing again. Push, 5 seconds, 1, 2, 3, 4, 5, and relax. Bring the knee up a little bit further, push, hold for 5 seconds, and relax. Until you get up about as high as you feel comfortable, and then actually what you can do is then work your way back down, doing that same thing of 5-second isometric holds. Again, probably those first couple contractions are going to be a little uncomfortable, feel a little bit of pain, feel a little bit of stress around that knee joint, but as you continue to do those isometric holds, you're going to get some blood flow, you're going to get some oxygen and nutrients to the joint, and you're going to start to have a little bit of a pain relieving effect, at least hopefully, that's the goal. The other option, so we did muscle contractions, what we can also do is incorporate mobility, incorporate range of motion of the knee joint. So stresses on and off, promoting that compression and relaxation of the joint to bring fluid, bring oxygen, bring nutrients to the joint. So the easiest way when you're laying down in bed is just doing some heel slides. And this instance, we're not doing the heel slides to really try to increase range of motion, so you don't have to go all the way up as much as you possibly can and really crank on it. You just have to do some gentle back and forth heel slides like this. Not holding it particularly long, not necessarily going all the way up to your max range of motion, Just doing enough to get that bending and straightening back and forth of the knee, compressing and relaxing that knee joint back and forth. And maybe do 15 at a time, take a little break, and try another 15. Another way that you could do this that incorporates a little bit of a stretch and a little bit of neurodynamics, so moving the nerves in your leg, is holding your leg up like this, and then trying to straighten the leg all the way, and then slowly letting it come down as far as you can. Straightening up all the way, slowly letting it come down as far as you can. And you'll notice you'll feel a little bit of that stretch in the back of the leg as you raise the leg and then come back down. And then the last one, of course, is while you're just sitting here, you can also do some seated knee extensions, or you can do heel slides back and forth. Again, just trying to promote that range of motion, that movement of the knee back and forth to get that compression and relaxation of the joint. So there's 2 or 3 simple ways to provide an analgesic or a pain relieving effect if you do have an episode of a flare-up of knee pain or knee symptoms, again, either before or after having a knee replacement surgery. I hope you found this video helpful. Please be sure to hit that subscribe button again. Please be sure to leave your likes and leave your comments and questions below, and I'll do my best to get back to you. Thank you very much for watching.